My name is Gloria Ngaiza, and I'm a second-year DPhil student. And together with Naima, we'll be discussing case study design. Okay, so we'll start with background information about case studies design, and that is before discussing the design itself. And eventually, we'll see examples of case studies. And because this topic is so broad, here are some key messages that we would like to communicate, and we hope to get through from this presentation, and particularly the approaches to case study design. And we are going to see various concepts in these presentations, and also the strengths of case study design and how they can be used, especially in complex systems. So there are multiple definitions, but also perspective of case study or case study design. And this is based on the way of doing research, or it can be based on the methodology of doing research. But there are three key components in defining case study that I would like to discuss today. So the first one is what a case study is. And the second one is how we conduct the case study. And the third one is why we do so. So a case study is an investigation of a single or multiple units. So this could be something concrete, like, for example, investigating an individual or a group of people, or could be something abstract, like a decision process in a certain context. And the aim of investigating a case study is to get a deep understanding of a certain issue, or it could be issues. And it uses various methods that we are going to discuss later. And why we conduct case studies, we have various explanations. And I'm going to discuss the first explanation, which has two reasons. So which is when we talk about intrinsic case studies, we use this to describe a particular unit. And that unit is maybe interesting or unusual, and we want to get more details. So in an intrinsic case study, the case study itself is interesting. So for example, a case study of an increase in teenage pregnancy in school X. So that school is already interesting because it has an increase in teenage pregnancy, and that is an intrinsic case in that particular context. Or another reason could be we are conducting an instrumental case study. So this is focusing on an issue or a concern in a wider context, but we use that case to illustrate the issue. So for example, the selection of maybe school X and Y to understand in general why there's teenage pregnancy in that particular country or particular county. So those could be the reasons why we're conducting. So that is the first explanation, but other people explain in a different ways. So for example, the first explanation could be we're conducting a case study to explain a phenomenon or an issue, and that is called an explanatory case study. Or it could be to explore a new research area in terms of like what should be done next, research questions or some of the procedures that needs to be explored. So for example, that is called exploratory case study. Another way it could be just to describe maybe what on why in maybe a sequence of events or a phenomenon, and that is called a descriptive case study. So I would like also to discuss a bit about the history and evolution of case studies. So case studies have a long history dating back to the 17th century, and they started in the field of anthropology, but also social sciences. And the aim was to investigate people's lives and their experiences and how they understood their social and cultural context in that particular world. And they are documented in terms of description or narratives. And in 1940s up to 1960s, case studies were very much criticized because of the thinking of logical positivism, that the idea or statements need to be verified. And because case studies were not seen as observational or experimental studies, they were not seen as strong as other studies. But because of this, with time in 1960s, there was a reestablishment of and the credibility of using case studies. especially after the introduction of the grounded theory. So that showed like case studies could be used to explore complex issues. And in early 2000, there's more use of combined qualitative but also quantitative methodologies in understanding or in using case study research. And in the next few slides, we're going to discuss various methods for case study research. I would like to highlight that there's no one way of conducting a case study research. We'll discuss various concepts and how they are similar, but also how they are different. But it's very interesting to learn that a few scholars don't consider case study research as a methodological choice, but rather they consider it as a choice of what should be studied. And they argue that there's no any clear guide for, like, for example, data collection, analysis, and interpretation. But there are some scholars who use qualitative methodology only in case study research, and others use both qualitative and quantitative methodology mixed. So that is what we are going to discuss in the coming slides. So we will start with the approach of conducting case studies by using the qualitative methodology only. So this could be a theory or a framework chosen to guide this kind of case studies. But sometimes a particular case study could end up developing a framework or theory. And under qualitative methodology only, case study research will see two arguments. So this slide is talking about the first argument, which says that the case study approach is independent of other qualitative approaches. So you can see we've displayed other approaches like narrative, phenomenology, grounded ethnography, and case study. And case study is a standalone approach. So they argue that data collected is through various methods, could be through interviews, could be through observations, documents, or artifacts. And data analysis is through maybe a description of the case and also using the themes for analysis. Next, please. But the second argument under the qualitative methodology only for case studies says that case study approach uses other approaches and is not independent of them. So this means a researcher can choose a case or can choose cases, then study them using various approaches that you have seen them, like narrative ethnography. So for example, they could use they could use narrative approach if telling a story about life or of someone or many people through interviews and documents. Or they could say this is a case study, but they use a phenomenological approach to explain like an essence of an experience. And the data could be collected through interviews or documents and observation, or the use of art. Or they could say this is a case study approach and they use the ethnographic approach to describe or to interpret a culture sharing group. And they could use observations and interviews, and they could be based in the field for a long time. Or they could even decide to use a grounded theory approach for data collection and to develop a theory. Next, please. So after discussing the qualitative only case study design or approaches, now I would like to discuss the second concept, which is the use of both qualitative and quantitative methodologies in case study research. So the quantitative angle in this context will answer questions like what, while the qualitative angle will answer why and how. And there could be a theory to test, and that is a deductive reasoning, or they could later they could decide to generate a theory after data collection. That is the inductive reasoning. And under these mixed methods of case study design, they have three approaches. So the first one is exploratory, explanatory, and convergent mixed methods. And on this slide, I'll talk about the exploratory approach. So this is a sequential design, and it starts with qualitative data collection and analysis. And from that, it will inform the development of a quantitative phase. So based on the data from the qualitative phase, researchers will develop maybe measures or instrument or an intervention for an experiment. So the second approach under the mixed method of case study design is the explanatory approach. So this is also a sequential design, which starts with the quantitative data collection and also analysis. Then they develop a qualitative data collection afterwards. So while the quantitative phase at the beginning will provide general outcome of the study, such as things like confidence interval and statistics or the significance of the study, the qualitative phase will give like an explanation of like why this maybe this confidence interval is like that, like the hows of the quantitative research findings. So the third approach in the mixed method of case study research is a convergent approach. And here the researcher will collect both qualitative and quantitative data and merge the results, so at the same time. And the combination of data will help to see the problem from multiple perspectives. So in this approach, the quantitative result will generate trends maybe and relationships, while the qualitative part will provide the in-depth perspective of or maybe individuals or phenomena, like why things happen the way they did. So after discussing various ways of doing or methods of conducting case studies, I would like to talk about the philosophical assumption and also the interpretive framework, because this is very important in choosing the approach for case study, like which one you're going to use and why. And also depending on the objectives of the research and the method used in the case study. So it's very important for the researcher to consider the epistemological standpoint, meaning is how will they acquire knowledge. I will briefly talk about it because I understand Professors Stacy and Caroline covered this topic in the past skills session. So I like this diagram because it shows how researchers will start from the time they're developing their research. So this diagram explains the process of developing the right research paradigm. So also based on the nature of the research. So as a researcher, we'll start by asking ourselves, what is good or bad? And what do we consider worthy or valuable in our research, or the kind of data we want to get? And this will affect how we conduct our research. So when we start with axiology, we ask ourselves questions like, what makes a good researcher? In terms of, should a good researcher be impartial, curious, or should the researcher be caring or diligent? And what is worthwhile science? Is it based on the causal or problem-centered or hypothesis-centered or experimental? So based on that, it is going to inform the following step of designing our research, so which is ontology, where as a researcher or as researchers, we ask ourselves what we consider is the nature of reality. Do we have multiple natures, or is it one nature of reality? Can we get different realities from different people, or we only have one reality, which is the only one we think is the truth? And based on that, it will inform our epistemology, which is what and how to know the reality or to know the knowledge. And after being clear on our epistemology, we move to the methodology, so which will help us to acquire the knowledge. How are we acquiring this knowledge? So in terms of case study design, if our epistemology is maybe, for example, post-positivism, how is our case study design going to be like? Are we going to use qualitative or mixed method? So it depends on what we consider as our standpoint. And from the methodology, we move to the methods, because the methodology will inform the method. So if it's qualitative, are we using interviews or observations or any other methods? If it's quantitative, are you using a questionnaire or another tool? And what will be the source of data to be collected? And yeah, this diagram is also just more information from from the previous diagram, and here I've just shown the two extreme angles of the paradigms and what they entail. So you can see the left side is a positivism, which is more quantitative research, and they believe in that the realities be governed by law, and they either support or they reject a theory, while on the right side is more of the qualitative research, social constructivism, uh, whereby researchers believe the reality is like socially constructed or is constructed by the environment, social constructed, and they consider theory as either credible or they can discredit it. And between these two, there are other paradigms. And I think if we refer the notes from Professors Sassi and Caroline, we'll get like more information. But I've put this just to show the importance of considering this in also choosing the type of case study design that one will consider in their research. So I also like to highlight some of the use of case study research, like where we can use case study research. We can use it to offer some maybe considerable potential or to strengthen the faith in both the external and internal validity of research, but also to provide some evidence about the context and also transferability of information that we collect. And also sometimes it can be used to strengthen the causal inference, or especially when we are using the pathways between intervention and effects, which are likely not linear, which are non-linear. So case study design can help to clarify that, but also can help to research evidence to have an impact on policy, but also system organizations, because they research a particular thing or a particular phenomenon in depth.
Thank you, Gloria, for that nice introduction into the topic. So now I'll just be emphasizing some of the strengths and criticisms of case study research. And like Gloria highlighted, a major strength of case study research is that it's quite useful for investigating complex social systems because it allows you to provide a rich and very detailed or in-depth understanding of that problem within a real life setting. It's also considered flexible because, as she showed, it's not fixed to any one epistemological stance or ontological approach. You can use both qualitative or quantitative approaches, and within those also it allows for a variety of methods to be used. So it's considered quite versatile, able to study a wide range of topics because of this ability to bridge across different paradigms. And like she started to mention also, it's good for providing evidence that is used for transferability, to strengthen theories, and to draw inferences. And it's quite practical because, again, it situates the problem within a real world setting or a real life context. But that being said, it is quite criticized a lot. And many of the criticism comes from this perceived lack of scientific rigor. So often when you look at the evidence hierarchy, you see case study really right at the bottom. Um, and some of the reasons why that is, there's issues around the credibility of the case study research, because many of the approaches are often qualitative, so that the issue of biases of the researcher comes in. There's also this perceived inability to generalize the findings to a broader level because you have done quite an in-depth focused look at one particular case within a certain context. It can be quite challenging because, as you've seen, if you're using different methods, then it means that you're going to be getting quite a large volume of data. And then it requires quite a lot of time and resources to be able to do that. And because of the use of mixed methods, this idea around the researcher's skill, being able to use these different methods and then integrating the multiple data sources to be able to come up with your findings. And I think many of these criticisms end up coming down to the quality of the reporting. So there's a lot of criticism around how the reports for case studies are quite poor, and it's amplified by these negative perceptions of rigor and validity. But again, these can be argued to be the same criticisms that are raised generally for qualitative methods. And it comes from, as Gloria explained, coming from researchers that take a more positive stance or approach, but they are still important to consider and think about ways to mitigate them. So some of those mitigating actions include, as she stated, drawing on a theory or a conceptual framework to be able to guide the design of the case study, allows it to be more explicit. Um, Even though data collection is flexible, it needs to be focused towards a particular goal. And that again comes back to relying on that theory. The importance of being able to triangulate your findings, so integrating all of them to come up with inferences and conclusions. There's also the importance of respondent validation. So going back to participants to check these findings as they emerge and then check them against your own interpretation as the researcher. And the value of ethical practices. So things like data anonymization, ensuring that you get informed consent, and quite importantly, reflexivity. So I think we spent quite a lot of time in Gloria's side talking about, philosophical assumptions and theoretical frameworks. And these just all come back to how the case study is conceptualized, how it is designed, and how it is conducted. So that taking time out to make sure that the case study is informed by these theoretical frameworks and epistemological stances is quite important. So, like I mentioned, a lot of the criticism is now centered on the transparency of how the research process is done and how that case study is going to be reported. So, really emphasizing the need for detailed methodological descriptions, which are often omitted in the papers that describe case study. And this transparency really involves defining clearly what the case is and the context in which the case study research is being conducted, the clarity of the philosophical assumptions that are informing the case study, and adequately describing the case study design and its components. So what is the case? What's the purpose of the case? How are you sampling? And then also a good description of data analysis. So there are some scholars out there who are working towards improving how case studies are designed and reported. And I'm going to present two of the ones that are quite popular right now. The first is Stake. So Stake has a checklist for assessing the quality of the case study that being reported. It's not a new checklist. It's been around for quite some time. And as you can see, it's more around, the clarity of the report itself. So I've highlighted some of the things that we've already mentioned. Is the report easy to read? Has the case been adequately defined? The context in which the case is occurring, has attention been paid into describing it adequately? Triangulation of the data, so the observations, the interpretations that you're getting, and being quite apparent around your epistemological stance as a researcher and what your positionality is. The second one I'll describe is something called the Descartes model. So it's the design of case research in healthcare model, which was developed by Carolan and colleagues as an approach to enhance how case studies are designed, conducted, and reported. And basically, the model looks at three important things. So it's the case, that's the case itself, the case study design, how the case study is being designed, and the case study, which is the output of that research. And three stages are important in this model. The first one is about situating the research and the researcher. So as we've mentioned before, being really clear around what the philosophical approach is and what the epistemological stance is. What is your own positionality as a researcher, and having been able to adequately consider ethical dimensions of the research. So things like reflexivity, as we said before, being able to take informed consent, and just adequately considering what might be the ethical implications of this type of research and how one should go about that. The second stage is around determining the components of the case itself. So what is the case? Clearly defining it and within its boundaries and within the context in which it situated, being clear about data sources and how you're sampling participants or your other sampling approach. And all of this should be guided by a conceptual or theoretical framework which informs the design and the conduct of the case study research. And the last part is being clear about the data analysis. So Caroline and colleagues advise taking three stances when it comes to data analysis. The first is, again, a philosophical stance. So like Gloria has mentioned, your epistemological approach will determine how you look at the data and analyze it. The second is a strategic stance, so being clear around how you're going to conduct your data analysis. And for case study research, is often around whether you're going to do a case-based analysis, so taking an in-depth look at the case itself, or looking at variables across multiple cases. Again, that's sometimes described as a within case or cross case analysis. And importantly, the last is the integrative stance, which is around how you're triangulating your data and how multiple sources of data are being integrated. So now I'm going to present some examples of case study research, and I'm hoping that as we go through the examples, you'll see the elements in which Gloria and I have talked about are important for case study design. The first one is by a group of colleagues in Kenya who were looking at tracking health sector priority setting processes and what outcomes that might mean for human resources for health. So they've clearly described the context in which this case is situated. So they've described that it's within Kenya following the evolution where health service delivery and human resource management were decentralized to county levels, but there wasn't much known around priority setting practices and how those affected outcomes for human resources for health within decentralized systems in low and middle income countries. The purpose of the case study is also clearly stated to examine if and how the Kenyan devolution has improved health sector priority setting practices and outcomes for human resources for health. The case for them is one county in Kenya, so it's a single case. And for the methodology, they're looking at a mixed method case study design, largely qualitative because it's taking document reviews, records of, and then also key informant interviews, but also has a quantitative element where they took data from databases and tried to do a descriptive analysis of human resource for health recruitment and deployment. So this is the study conceptual framework. We've talked about how important it is to have a framework that is guiding the design and conduct of the study. And for them, they chose Walter and Gilson's policy analysis triangle, which essentially looks at the problem within the content of it, the context, the process, and the actors that are involved. So for data analysis, they employed a framework analysis approach, which you'll see is quite common for many case study researchers because of the way it's sort of pragmatic and allows you to come out with a nice framework of your findings. And then they also developed key themes and sub-themes using their study objectives and relying on the conceptual framework. And if you look at their findings, it reflects some of these aspects of the conceptual framework. So they looked at the context again and said, devolution has significantly increased county level decision space for human resources for health priority setting in Kenya. And then they also talked about some of the processes. So human resource for health recruitment and distribution, stating that there were county level innovations to address issues around management challenges such as contracts for specialized staff. So this just shows how they've used those elements of the conceptual framework, defining the case clearly throughout the study, right up to how they describe their findings. The second example, again, is by colleagues in Kenya, where they were looking at priority setting and resource allocation being a key determinant for health system performance. But so far, the focus has been at the macro level of the system or the national level without looking at regional or health facility level, particularly within hospitals. So the purpose of this was to look at county level hospitals and how they conduct priority setting practices. Again, it's mixed method case study design in the methodology, but this time wholly qualitative. So using in-depth interviews, document reviews, and non-participant observation. And for the theory that they're using to guide their methodologies, something called the complex adaptive system theory to examine what factors might influence priority setting practices. So again, they've used a framework approach, but they call it a modified framework or thematic approach. And again, like I mentioned, it's quite popular in case study design because many people feel that it gives interpretations that are relevant to policy and also allows you to come up with quite pragmatic recommendations. So for this example, there are two cases here. So it's two hospital cases that have been selected to be able to show differences in the level of resources But here they've done something where you will see in case study, it's called a nested case study design. So within those hospitals, they've chosen particular priority setting practices to look at in depth rather than looking at all priority research and priority setting practices within the hospital. So sometimes case study researchers will do this type of nested case study design. And in the findings here, they've used that complex adaptive theory to be able to just describe how priority setting practices are occurring within the context of the hospital. So just trying to show that hospitals themselves are complex adaptive systems, and these are all the factors that influence those priority setting practices. And therefore, the interventions should be able to recognize that hospitals are complex adaptive systems. So next, I'll hand back to Gloria to explain her DPhil, which is also using a case study design as an example.
Thanks, Naima. I'll talk about my DPhil research. In my research, I acknowledge the importance of medical technologies in improving the quality of healthcare, especially in newborn care. But also, I understand that these technologies are being introduced in complex health systems, and implementation is not always easy because there are some context-specific issues that actually could interfere with the implementation and could lead to some results which were not expected. I also acknowledge that these technologies might play a part in how health workers, but also caregivers of sick babies interact in the newborn unit. So I'm researching how the use of these technologies shape communication, but also decision-making in newborn units in Kenya. And so I aim to understand the context and the dynamics within the newborn unit. So that's my primary aim. And it's in this newborn unit is where the technologies are introduced. I would like to understand like what influences this communication, but also decision making. And so through that, I study health workers, but also caregivers from their practices, their experiences, their perspectives. And so you can already tell that I'm using the social constructivism philosophical standpoint. And I use observations, interviews, but also review of documents as my methods. And yeah, so my research is in newborn unit. And so I have chosen 2 hospitals as my cases. So these are 2 hospitals with different characteristics in order to compare and to contrast. So this choice is informed by my literature, also to understand some of the things that could affect communication and decision making with the use of technologies. And so I've chosen these 2 cases based on the geographical location of the hospital. So one is peri-urban, another one is a county hospital away from Nairobi. The newborn unit size, so one is small, another one is relatively large. And also how busy the hospital or the hospitals are. So one is not very busy, another one is very busy. The duration of using the technology. So there's one hospital which is using these technologies for the first time, and another one which has used these technologies in even the past projects. So you can already see that these hospitals are my instrumental case studies. So I would like to understand how the use of technologies is associated or is influencing communication and decision making in Kenya. But I'm using 2 hospitals as my instrument. So they're not themselves special or peculiar. I'm not trying to understand any particular thing, but I would like to understand the context of Kenya using these 2 hospitals. And I'm also using qualitative only case study approach. I'm not using a mixed method. And this is based on my objectives, like what I would like to understand, perspectives and practices. And the technologies are focused on CPAP and phototherapy. So I aim to understand the communication associated with the use of these 2 technologies. And data analysis will start with within case analysis. So this is a description. I will describe each hospital, the communications and decision making that are associated with the use of technologies in these particular hospitals. And then after that, I'll do like a cross-case analysis, which is comparing and contrasting the cases. I realized when I was preparing with this presentation, another person could argue that maybe the technologies could be my cases, like CPAP and phototherapy could be my cases. But that could be the case if maybe my objectives were different. So you can already see like a hospital could be a case or a technology could be a case. So that is based on what you're interested in, what's your interest, what are your objective of conducting that study. And also you saw Naima's example, you could also have nested cases. So within a case, you also have other objectives you would like to see. And this is my conceptual framework, which is informing my data analysis in these two hospitals. Yeah, over. Back to you, Naima.
Thanks, Gloria. And the final example will be my DPhil, which is examining governance arrangements for medical devices within Kenya. The background and context is quite similar to Gloria. So again, knowing that governance arrangements are known to be important for influencing how technologies are used to improve the quality of care, but how these arrangements and processes occur is not well understood, particularly at subnational and hospital levels, and what the needs of stakeholders might be. So I'm also looking at the introduction of a bundle of technologies in newborn tech units in Kenyan hospitals as an opportunity to be able to investigate this. So the purpose of the case study is also tied to the purpose of the DPhil, which is to examine how governance structures and processes occur at national, subnational, and hospital levels, and how these interact to shape how technologies are introduced and overseen within Kenya. So like Gloria described, for me, it's also an instrumental case study design. So looking at the broader phenomenon of governance, but using the hospitals as instruments to be able to look at that in depth. So it's a qualitative case study. I have in-depth interviews, document reviews, and non-participatory observations as my data collection methods. And participants will be drawn across those three levels of the health system. And the cases for me are 4 county hospitals, where I'll be looking at governance processes for select newborn devices like Gloria did as nested cases. I've also clearly stated my interpretive stance, which is a social constructivism or pragmatic stance. And I have a conceptual framework that is guiding the design and conduct of the study, again, using a modified framework approach for my analysis, doing within case analysis, so giving a good description of the individual hospitals, and then also cross case analysis to be able to identify patterns and make comparisons. So just to summarize some of the things that we hope will be take-home points is that case studies are useful for providing in-depth and multifaceted understanding of complex issues within real-life context or real-world settings. And that case studies may be approached in different ways, but what's important is the epistemological stance of the researcher, because that then guides how the case study is designed and conducted and reported. Many of the concerns and limitations that around rigor and generalizability will remain, but again, we're arguing that this can be mitigated by using these systematic procedures to design, conduct the case study and also to report it. So what's important is that there's clarity and that there's transparency throughout the research process. So in conclusion, the case study approach lends itself quite well for the study of complex events or events within complex systems and to be able to study key issues within health and healthcare delivery in real life contexts. And nowadays we're recognizing that a lot of the innovations, interventions, and programs that are being implemented in complex health systems. So we're advocating that the use of case study approach should be more widely considered, and that really what's important is these systematic approaches to conceptualizing it, designing it, conducting it, and reporting the case studies, which will then improve these perceptions of rigor. These are our references. Thank you very much.